Let's say you find yourself in need of medical attention. Where should you go? The ER, urgent care, the hospital, a doctor's office? There's so many different options, so let's break them down. Should you go to the hospital? Well, going to the hospital is essentially the same thing as going to the ER. If you walk in needing medical attention, the emergency room is where they'll take you. What about a doctor's office? This is where you go typically for non-emergency ailments like coughs or fevers or even for wellness visits. Which doctor should you go to? The choice is yours. Whoever you choose, this will be called your primary care physician or PCP. If you're not sure how to find a PCP, we at Northwest can help you find one. This leaves two real options, urgent care and the ER. So when should you go to urgent care?
The time to come to urgent care is when you have a sore throat, you have an ear infection, you think you have a UTI, say you have a cough or a fever, say you fell and cut yourself, or you fell and you're worried about a broken bone. We also can check patients, say if they're concerned about pneumonia, where we can do a chest x-ray on them.
Great. And when should you go to the ER?
If you're experiencing things like chest pain or stroke symptoms, or maybe your kiddo is having an asthma exacerbation, there are diagnostic tools that we have available in the emergency room that are not available in an urgent care or a primary care setting. For example, things like a CAT scan if you're having potentially a stroke, or maybe you're on anticoagulation or blood thinners and you fall and hit your head. We can do a CAT scan of your brain and make sure there's no bleeding. One good rule of thumb is if you're unsure, well, you can try the urgent care first, because we have a great relationship with our urgent cares in town, and if there is any question, they typically will call us here at the freestanding emergency room and let us know what's going on, and we can help direct them. And urgent care is going to be more affordable than an emergency room visit. However, if you are having a true emergency, chest pain, stroke-like symptoms, asthma exacerbations, make sure you come straight to the emergency room and we will be happy to take care of you.
So there you have it. Hopefully this helps you know where to go the next time you're in need of medical attention. Northwest is bringing care closer to home.